Hello, I'm Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California. So you've been diagnosed with sciatica, have you? Well, you might be feeling frustrated, annoyed, confused. These are all pretty justifiable feelings because a lot of times what happens when people are diagnosed with sciatica is that their doctors will tell them just go home and rest. Or they'll prescribe pain medications. But oftentimes you're left feeling like, why isn't there more I can do? So to really look at sciatica, we have to figure out what's true sciatica and what's a false sciatica, or something that mimics sciatica. True sciatica is something that stems from the disc in your low back. Typically L4, L5, there's pressure on the disc or there's an injury to the disc, and that causes the nerve to leave that area to become impinged and often inflamed. But there's many things that can mimic this condition. So let's back up a minute. The sciatic nerve, it starts at the nerve root and it travels through the glute, through the hip, down the back of the leg, even down into the foot and then to your big toe. So you kind of think of it like a piece of spaghetti, right? You've got a bowl of spaghetti and meatballs, and one of the spaghetti strings is traveling along the whole bowl. It's a good one, it didn't break when you're cooking it. And there's different meatballs laying on top of the spaghetti, right? So if you think of the spaghetti as a communication wire of sorts, anytime the meatball is pressing down on that strand of spaghetti, the interference is going to be such that there's not going to be good transmission along the spaghetti strand, or the nerve, right? So the meatballs are the disc in the low back. There's another meatball called the piriformis, and something that's called Piriformis Syndrome. When that muscle called the piriformis gets inflamed and injured, it presses on the nerve, so that's Piriformis Syndrome. There's superior gemelli syndrome, another meatball. There's inferior gemelli syndrome, yet another meatball. And then on down the chain, it can get stuck in the high hamstring, it can get stuck in the hamstring itself, it can even get stuck in the calf muscle once it branches off, and you know, spaghetti strands don't really branch off, but you get the picture here. So in order to figure out how to treat your sciatica, you need to know what's causing the sciatica in the first place. Sciatica, the word sciatica, is nothing more than a cluster of symptoms. Telling somebody that have sciatica does not tell them really any information at all. It just tells them that they're feeling the symptoms that they already know they're feeling. So they're feeling back pain, or they're feeling hip pain, or they're feeling a burning sensation down their leg. That's what they're feeling, that's sciatica. But to put a diagnosis to it, we need to look at the meatballs in the spaghetti. We gotta say, is it the piriformis muscle that's injured? Is it the superior gemelli? Is it inferior? Is it hamstring? Is it this? Is it that? Is it this and that? And once we put a diagnosis on it, then we can treat it. So that's where active release techniques come into place. Because active release techniques is a hands-on, movement-oriented soft tissue system that has protocols to release the adhesions that form in each of these problematic meatballs or problematic muscles. So the most commonly known one is piriformis, right? You've heard of Piriformis Syndrome maybe? So there's a protocol to actually reduce the amount of adhesions in the piriformis muscle. So with active release technique, you'll shorten the muscle, and then you'll take a thumb or a hand contact right on the adhesion. So the adhesion is found through exam, it's found through palpation. Diagnostic imaging can help in some situations, but mostly it's the palpation skills of the practitioner. They're going to help you find the cause of that sciatica, get on that adhesion, and then once you're on there, the tissue is lengthened out while the contact is held. So I'm going to show you a picture of this. I don't have a video right now of me doing the Piriformis Syndrome protocol, but you can see from the picture that the patient is actually going through a movement. They're moving their leg from a shortened position to a lengthened position so that the adhesion can be broken down, and you're one step closer towards treating that Piriformis syndrome. Within the active release technique system, there's protocols for each of these meatballs that I mentioned, the inferior gemellus, superior gemellus, hamstring. There's several protocols for hamstring depending on where the nerve is entrapped or where the adhesions are found. There's actually several causes of sciatica that are not adhesion related, and these would include pregnancy, being overweight, spinal stenosis, which is usually something that requires a surgical intervention, and other random things that don't come up that often in practice, but you still need to know about them. Like, for example, a tumor might be something that's growing in the area and it's pressing on either the nerve root or the nerve and causing the same symptoms to be felt down the leg. So once you break up the adhesion in the muscle, the nerve that's either under the muscle or sometimes even going through the muscle, in the case of the piriformis, the nerve can glide freely again. And that's a huge thing. The biomechanics of the area are restored, and there's less pain and less tugging on the nerve. So once you've got those tissues functional again by treating with active release techniques and chiropractic treatment, you'll need to look at the tissue capacity. Is it able to handle the load that it needs to handle? If not, that's when rehabilitation exercises come into the mix. Your chiropractor can prescribe specific exercises for you depending on what was the cause of the sciatica in the first place. So let's take, for example, if the sciatica is being caused by a weak hamstring, then you might need to focus on strengthening the hamstrings. If the problem was caused by an adhesion in the hamstring muscle due to a hip weakness, okay, you're going to need to focus on strengthening the hip muscles. Sometimes the glute muscles, they turn off, right? So this is kind of a funny wording, but there's something called reciprocal inhibition. So when we sit all day, our hamstrings, or sorry, not our hamstrings, our hip flexors are in a shortened position, okay? They're crunched down. The hip flexors are the muscles that run from the deep belly here into the top of the front of the leg. And so if you're sitting all day, your muscles are in this contracted position. And when a muscle is in this contracted position for so long, it actually turns off the muscle on the back side of the body. So the muscle that's opposite to the psoas muscle is the glute max, right? The big glute muscle in the back of the body. And if the glute max muscle is not working like it needs to be working, something else is going to need to take over. So our bodies are pretty amazing at compensating and getting us where we need to go. And if the glute max is not working, the smaller muscles are going to take over. So the piriformis, sound familiar? The superior gemelli, sound familiar? The inferior gemelli, sound familiar? So they're all designed to do something slightly different than the function of the glute maximus, but since they're in the same area and they're the closest match, they're going to take over and start to try to do the function of the glute max. So as you can see, this is not an ideal situation. The muscles are doing this work that they're not designed to do. They soon become overworked. There's not enough circulation. There's not enough oxygen. There's an inflammatory process in which adhesions are laid down. And once these adhesions form, that's when you start to get that sticky situation where the muscle is pressing on the nerve, or if the nerve is going even through the muscle is actually clamping down on the nerve and not allowing the nerve flow to happen. So that's a little bit of information about sciatica. There's a lot more to know and a lot more nuance to it. If you have any questions, please feel free to send me an email, info@riverstonechiropractic.com, and check out my website for more articles and information, riverstonechiropractic.com. And if you want to find out if you're a candidate for active release treatment here in Oakland, please give us a call, 510-465-2342. All right, thanks for watching. Bye.